why do we exist? Why are we here? Right? So no one faces epilepsy alone. So that statement begins to guide all of our work. Does this program, project, initiative fulfill the vision of individuals not walking alone? Right? Does it fulfill that? If it doesn't, then it's not for us. We are all about serving the community and making sure that we're walking alongside, not in front, not behind, but alongside that patient and caregiver. I love the curb cut theory because it was designed for the margins. It was designed for those with mobility issues. But if we look at what curb cut has done for society, it has improved commerce. It has improved quality of life for families. It has done all these amazing things that it was never intended to do, right? But because it was designed for the margins, others found usefulness in that design. And so we are attempting to do the same thing at the Epilepsy Foundation. When we consider new programming or initiatives, it is always considered from the margins. But because we know if we get that right, then everyone in between will benefit from the work. Well, it's starting with our Empowered project that we're working on right now, our Nora Impact Fund, as well as our chatbot, our empathetic chatbot. It really is being able to utilize technology effectively and efficiently within our work, right? And not only to be able to use it to promote programs, initiatives, but also to develop earned income streams. Currently we are in a landscape where funding is challenging, right? Particularly for large organizations who have a research focus, such as we do, and a public health focus. Those federal funding opportunities are going away. And it's more important now than ever for us to lean into earned income strategies. And that is going to be how we intentionally use data to spur innovation with our pharma, medtech, and biotech partners. We are probably, we tell our partners, which I know is a shift for many, is we say, we want you to be profitable. We are invested in your profitability because when you are profitable, you will stay and continue to innovate in the space. And what that means for our patients is better health outcomes. Also, we're not afraid to say EFA needs to be profitable. I had one physician say to me, "Oh, you mean solvent? You want to use the word solvent?" I said, no, I mean profitable. Because when we have profitability, we can pour those profits back into our community based on the community's needs, based on the data. And people get so shocked when nonprofits talk about profitability. And it goes back, and I say this all the time, but words that really impacted me from Laura McDonald, where, you want to be seen as worthy and not needy. And that really has stuck with me because when you're worthy, people are willing to make investment. When you're needy, people donate. And we want individuals to make investment. And we shouldn't be afraid to say that what we're really asking for is an investment into our mission and into our work. And it's always beneficial to have an objective partner who can say, but here's the goal, right? Keep your eye on the goal. Okay, where are we at? How do we get there? What do we need to change? And I just honestly don't think that you can find that within your organization. Like, you need someone who is outside of the organization looking in, making sure that you are sticking to your plan. Because honestly, inside the organization, particularly given the times that we're in now, it would be easy for all of the leaders to say, we just need to focus here. We just need to be able to focus right here, right? But it's also, I feel, inspirational and hopeful when you have a partner who can come in and say, but this is your goal. Remember, this is what you said. So let's continue to work to get there. Finding the right partner is really important too. And the benefit I had coming into this role was I had already worked with Benefactor Group. I knew the style. I knew the style worked well with my style. I really felt that Benefactor Group gave me the team that they knew would be most invested in my mission, right? Because my mission becomes your mission. And so there was also a comfortability there of work because I knew what the result could be. I knew how the organization operated, the level of professionalism, the level of skill that they were able to bring. And I've seen that time and time again, working with Adam and others and other parts of the organization, that there is a level of expertise across the organization, and very, very similar style of how they work with someone. I always feel brought into, not led, if that makes sense. You know what I mean? Like I feel brought into. And I think the team feels that way as well. Like we're brought into the process, right? Um, we don't feel like we're being led through a process, but more being brought into it and discovering it together. And so it's like those reactions from people who are like, this is what I've been wanting. This is what we've been looking for. This is what we've been trying to accomplish and couldn't have. And, even as I told my board, we wouldn't have been able to accomplish that again without that objective outside partner. With all the travel I do and all that, it's just nice to know that there's other people that have their hands on the steering wheel, right? Like that for me has been the biggest gift, is that I can go do the other things that I need to do and know that this work is still moving forward. If you're a CEO who thinks that you can do it all by yourself, that is your first mistake. You cannot do this role single-handedly. You just simply can't. I just feel like the team is phenomenal. I don't know how you manage to just really hone in on the mission of the Epilepsy Foundation the way you do, because I know that you're working with multiple partners, right? But I feel like when you're with me, that you really have embraced the mission and are working towards our mission, and that's so rare. Consultant to feel that you feel like in that moment you have their complete attention. I would advise any nonprofit to bring a partner on to help them be that growth partner, right? You talk about executive coaching. I look at this as executive coaching for an organization, right? This is what this is. It's that executive coach. Sometimes it'd be like, I don't know how to move forward. And that executive coach is going to help you think through it and put you on the path, right? And then hold you accountable to that path as you go. And that's what Benefactor Group has done for us, right? They are, in my mind, the executive coach of the organization. And therefore, if we're at 90 feet, they're at 180, right? And they're able to see the landscape and bring it back down to us so that we continue to grow.